Welcome back, guys. We are moving ahead with the new topic of LA, that is mechanism of action of LA. So, there is a electrophysiology of nerve fibers. As we have read, studied earlier also, that our nerve membrane has two kinds of potential, resting membrane potential and action membrane potential. How does an LA work? We will see. Firstly, there is a resting membrane potential which is in minus 60 to minus 90 MV. Then stimulus excite the nerve. Stimulus, what is stimulus? Stimulus is LA. Okay, then there come a phase of slow depolarization which is of 0.3 millisecond. After slow depolarization, there is a threshold. When it is reached, it causes an action potential to generate. Then there is a phase of repolarization which is of 0.7 milliseconds. Okay. Then what is that? Resting membrane potential, then stimulus, then slow depolarization, then action potential generation, and then repolarization. From this to this, it take 1 millisecond. Okay. Now, what is the nerve membrane? How is the nerve membrane during resting membrane potential? During resting membrane potential, there is positive charge outside and negative charge inside the nerve membrane. Okay, there is only influx or efflux of Na plus ion, and the normal resting membrane potential is minus 70 millivolt. Now coming to depolarization. Depolarization is divided into step 1A and 1B and 1C. Okay, what happened? First there is slow depolarization and we will reach threshold. So what happened there? Ki Na plus influx increases and K plus outflux is decreases or is inhibited. Okay, then there is more Na plus influx. Okay, that is rapid depolarization. In slow depolarization, there is Na plus influx and no outflux of K plus, and there is slow depolarization maintaining minus 50 MV to minus 60 MV. And in rapid depolarization, there is more of positive charge inside, less of positive charge outside, or it has become almost negative outside. That is rapid depolarization. What is resting membrane? Positive outside, negative inside. And by the end of depolarization, which is followed by slow and rapid, the membrane become negative outside and positive inside due to efflux of Na plus ion. Okay. Now coming to repolarization. Again, what happened? Now, efflux of Na plus ion is controlled or is inhibited. Now there is outflux of K plus ion, which again result in positive charge outside and negative charge inside, restoring to the normal. Okay, that is the phase of repolarization. How it is done? First there is resting membrane potential, negative outside, positive inside. Then there is depolarization and there is repolarization. Okay, in resting membrane potential there is negative inside, positive outside. In depolarization there is negative outside, positive inside, and again in repolarization there is positive outside and negative inside. So what happened to the membrane channels and gate present at the nerve membrane? In resting stage, the gate is closed. Okay, in depolarization, full open gate. We have seen that both side it was taking, and in repolarization, half open gate. Only outflux of K plus is going on. Now after this stage, after this electrophysiology of nerve fibers, we what happens? Spread of impulse. Now how will impulse spread? Either by unmyelinated nerve fibers or myelinated nerve fibers. Unmyelinated nerve fibers have high resistance cell membrane and low resistant intracellular and extracellular media. There is rapid decrease in density of current flow. The conduction rate is 1.2 meter per second, and mainly it is seen in C fibers which carry dull aching pain. The spread of impulse is very slow. It is in forward direction and it is in creeping progress, as we can see. Now coming to myelinated nerve fibers. Conduction occurs by the mean of current leap. We can see from node to node. This is happening in myelinated nerve fibers, from one node to another node. This is also known as saltatory conduction. What happened in myelinated nerve fibers? Saltatory conduction. Okay, the conduction rate is 14.8 to 120 meter per second. It is seen in A delta and A alpha fibers and the stronger stimuli, and it is more rapid, fast and energy sufficient. This is how impulse is spread. Now coming to what LA does, as in action of LA. हमारा फिजियोलॉजी हो गया, हमारा इम्पल्स जनरेशन हो गया. अब हाउ डज इट बाइंड टू मेम्ब्रेन? तो द नर्व मेम्ब्रेन इज द साइट एट विच LA exert their pharmacological action. It alters RMP. We have read about resting membrane potential. Then it alters action potential. Then it decrease the rate of depolarization and prolong the rate of repolarization. What it is doing? It is decreasing the rate of depolarization and prolonging the rate of repolarization. Okay. Now there are some theories. There are acetylcholine theory, which says that acetylcholine is involved in nerve conduction, but no evidence was found. Then second is calcium displacement theory. It says that calcium ion displaced from membrane site altered Na plus permeability. It is also not acceptable now. Now there is surface charge theory or repulsion theory. It says that LA bind to the nerve membrane, changing the membrane potential at surface, decreasing the excitability of nerve, increasing the threshold potential. But according to today, it has been said that resting membrane potential is unaltered by LA. Now two of the theories is accepted today, that is membrane expansion theory and specific receptor theory. Membrane expansion theory, mainly benzocaine work by this theory. What happened? LA molecule come and expand this membrane by binding to them, and thus the action occur. Okay, this is lipid membrane both side. This is the channel, and LA molecule bind here, expanding the membrane. We can see expanding the membrane. Okay. Now the specific receptor theory. It is the most accepted theory. Act by binding to a specific receptor on sodium channel. The action of the drug is direct. That means LA molecule replaces calcium molecule at calcium gate. Thus permeability of sodium is reduced or eliminated. Nerve conduction is blocked. We can see here that LA is binding to the specific receptor and Na की या सोडियम की ये एंट्री बंद कर देता है और खुद जाके बाइंड कर देता है. दिस इज द मोस्ट एक्सेप्टेड थ्योरी फॉर द मैकेनिज्म ऑफ LA. Now there are some facts to be known, like amide versus ester. The main difference, as we have seen the classification of LA, it based on amide and ester. Then mechanism of action or metabolism of these are major difference. Amides, majority of drug is metabolized in liver, so it should be used in patient. It should be used with caution in patient with severe liver disease. And second is ester. They are metabolized in plasma by pseudocholinesterase. Okay. And PABA is the major metabolite of ester metabolism. This is the known allergen. Okay. Now solution. 0.5% means 5 mg per cc, 1% means 10 mg per cc, 2% means 20 mg per cc. This is routinely used as we have seen in previous class in the composition. Now, for how many mg we have, we should multiply by 1.8 cc. This is the approximate. And most importantly, while administrating LA or before administrating LA, there should be pre-anesthetic evaluation. That means you should know if patient is allergic to some drug, you should know all the medical history, you should know how it is being used or age of the patient, sex, everything you should know. Now maximum doses of LA. Without vasoconstrictor and with vasoconstrictor. Without vasoconstrictor, it is 4.4 mg per kg and 2.0 mg per lb. And what is maximum recommended dose? That is 300. And with vasoconstrictor, obviously the dose will increase 6.6 to 7, 3.0 and 500 maximum recommended dose. Some fact about lidocaine or lidocaine is it is introduced by Lofgren in 1943. Other name are xylocaine, octocaine and dentocaine. Chemical name is diethyl 2,6-dimethyl acetoinoside and onset of action is 2 to 3 minutes. And again there is duration of action. Duration of action with vasoconstrictor is 45 to 75 minutes and without it is less than 30 minutes. So we can see adding vasoconstrictor will increase the duration of action of LA, which we need. Okay, contraindication. Two of the syndrome is well known where we should not give lidocaine is Ehlers-Danlos syndrome and attention deficit hyperactive syndrome. What all activity does LA or lidocaine specifically have on CNS? It is a powerful CNS stimulant. It causes drowsiness and lethargy. At higher dose, it produces stimulation followed by depression. पहले stimulation होगा फिर depression होगा. CVS, it has anti-arrhythmic action. Blood vessel, it has vasodilatation effect, and in respiratory system, it has relaxant action on bronchial smooth muscle. So guys, finishing of this class, in next class we'll study in detail about vasoconstrictors, which one is used and in how many doses. Thank you. Please like, subscribe and comment.